John, I've talked to you, we've talked a couple of times. 6 years ago, when Senator Cole ran for Congress, one of the main planks in his platform was to do away with the non-negotiation clause. Now, have any of you heard Senator Cole get up and sponsor a bill or speak against that non-negotiation clause? I didn't. And so now, as soon as this was formed, I've heard that in order for, this was reported on only one newscast that I heard it, that in order for the pharmaceutical industry to dribble some money into the donut hole, those who were negotiating had to agree they would not bring up the non-negotiation clause. And now that's, Mr. Baucus was at the head of the bill at that time, and I thought, well, he just fixed himself up. Guess what? 3 weeks ago it was announced. Guess who's not going to run for Congress again? Townsend didn't run for Congress after he got the Medicare reform, and then he became a lobbyist for the pharmaceutical industry, started out.
Bigger,
$2
president.
million.
He's the president of the Pharmaceutical Society.
Yeah, he is now. Yeah, I don't know what he's making now.
The other people have, like,
Yeah, so anyway, now, guess what? Mr. Baucus just announced that he's not going to run for Congress next time. So he just fixed himself up with a job. He'll probably get $3, $4, $5 million as a lobbyist for the pharmaceutical industry.
Thank you.
We just have time for one more question, then we'll go on.
I may not have a question, but why don't you bring it up that the man that designed the donut hole was Tommy Thompson from our government, from the state of Wisconsin. So be proud of him, what he did to you.
Well, once again, I'm Noreen Holmes. I'm Director of La Crosse County Aging Unit. Some of you may have been to our congregate meal sites. Some of you may have gotten home-delivered meals from our office. We also do the National Family Caregiver Support Program. We have the Elderly Benefit Specialist. She's here, but she's not very old. She's in the back of the room over there, Tina Johnson. So many of you have probably met her. Asking questions about Medicare Part D, supplemental insurance, Medicare Part C Advantage plans. She's trained to answer those kinds of questions for senior citizens. I wanted to let you know that there are two things that are affecting programs. Actually, there's probably more than that, but two that I'm going to talk about right now. One of them is, every time they do the census, they reconfigure the formulas that they use to distribute funding to all 50 states, but also to the 72 counties and the 6 tribes within Wisconsin. They do that based on how many senior citizens are in Wisconsin versus other states like Florida, Arizona, who have a lot higher number of senior citizens. But in addition to that, part of the formula is based on poverty numbers for senior citizens. So those are reconfigured, those formulas are refigured about every 10 years. Now 2010 is when we had the census, and there was a very big adjustment for the poverty segment of that funding. La Crosse County didn't do too badly, we stayed pretty flat. But some counties, vis-a-vis other counties in Wisconsin, lost double-digit figures in their funding for the meals program. Sometimes 28%. I think that was the highest amount I saw. When I look at that as an aging director, I get a few shudders because I think, how could you ever keep your services current at the current level if you lost 28% of the funding? So that has been a real concern for aging units. The Department of Health Services is aware of this, and so they have allocated GPR, general something revenue, general purpose revenue, to make up that difference, to keep aging units whole. By whole, I mean at 2012 level, flat. And that is actually already being done in the state, but only through June 2013. So we have asked, the Aging Network has asked the state to continue to put in funding that will keep aging units at 2012 levels. This would be about $1.76 million over the biennium, or about $850,000 for each year. That actually is a small amount of money, although it sounds like a lot of money. It actually is a small amount of money in the state budget. What it would do for individuals is worth so much more. Home delivered meals, especially when we bring meals to homebound seniors, we give them the ability to stay in their homes, in their communities. That saves money because if they have to enter the long-term care system, to go to assisted living or nursing homes, it's a lot more money. So the home delivered meal program is actually a very cost-effective program when you think about the long-term effects of helping older people stay independent in the community. We also are looking at, due to sequestration, we are looking at about a 5% cut in our federal funding. A 5% cut in federal funding is even difficult to make up and still keep your services at the same level. The aging population continues to grow. The cost of food, especially last year, also went up. So the funding was reduced, but the number of people needing and requesting services did not decrease. So there are many challenges for aging directors in this budget and in continuing years, depending on what the federal government does with sequestration. I happened to fly to Portland, I think it was 2 weeks ago, but I lose track of time. And so I was in the airport when they were talking about air traffic controllers having to be furloughed so that they were, it was causing backups at the airport. I wondered why the fares were cheaper on the day that I picked to go. And I think it's because a lot of other people figured out what was going to happen, but unfortunately I didn't. So I was flying at that time, and while I was visiting my son, I was quite surprised to learn that they had already figured out a way to get those air traffic controllers back on the job. So that took about a week and a half, I think, or it could have been 2 weeks. And I thought, and we can't find enough money to give meals to senior citizens. I just thought, something's really wrong here. So I would ask you to bring back the message to, let's find a way to solve sequestration so that we all don't get hit with those 5% cuts. We actually don't see that cut till next month. So we have a little bit of time, and it really should be enough time because the air traffic controllers didn't take that much time. So that's my sarcastic remark. I mean it in a friendly way, though. So, and the other portion that we will be affected by, state government has decided that they would like to put elderly and disabled transportation, which is part of transit. They want to make that part of the general budget, or we have to compete with other programs for funding. What's bad about that is currently we're funded through a separate transportation fund that is designated for transportation only. So we are very supportive of keeping our elderly and disabled transportation as part of the transportation fund. No, I don't want to compete with other agencies. We find more and more people